Dear students, today's topic is anatomy of liver. So here is the liver in the abdominal cavity, where it is a vital organ which carries more than 500 roles in the human body. Liver is classed as part of digestive system. The role of the liver includes detoxification, protein synthesis, and production of chemicals that helps to digest food. Liver is the only visceral organ that can regenerate. The liver is the largest solid organ in the body. The skin is the only organ heavier and larger than liver. So let us know little gross anatomy of liver now. So general structure of liver. So liver is considered as the largest gland in the body. The weight of the liver is approximately 1.2 to 1.5 kilograms in adults. That is approximately around 2.6 to 3.3 pounds. And in newborn, it is 1/18th of the body weight. That is, it is up to 150 grams at birth. The shape of the liver is wedge shaped and it has 4 lobes, which are the further divided into even smaller segments according to their blood supply. So here is the image of the liver, where you can see the liver is divided into smaller segments based upon their blood supply. The right lobe is the largest of 4 lobes of the liver. So anatomically we can see the right one. This is the right lobe, which is the largest lobe. This is the left lobe. And inferiorly we can see 2 more lobes called as quadrate and caudate lobes. So the quadrate lobe is situated on anterior visceral surface of liver between the fissure for ligamentum teres. So here is the fissure for ligamentum teres. So the fissure for ligamentum teres is on the left and fossa for the gallbladder is on the right. So here is the quadrate lobe. The next lobe is the caudate lobe of liver, which is situated on the posterior-visceral surface of liver between the fissure for ligamentum venosum. Which is present on the left, and towards the right is the groove for inferior vena cava. So these are the boundaries of quadrate and caudate lobe. And liver is surrounded by a thin connective tissue which is called as 𝐒𝐮𝐻 capsule. 𝐒𝐮 capsule is a thin innervated layer of connective tissue that surrounds the liver, blood vessels and bile ducts. Liver is a peritoneal organ. It is completely covered by the visceral peritoneum, and with the exception of bare area, which is where the liver is in contact with the diaphragm. Let us understand about the segments of liver. Anatomically, liver is divided into 8 𝐶𝐻 segments. 𝐶𝐻 segments, according to the nomenclature of the 𝐶𝐻, the hepatic segments are numbered 1 to 8. First to 4 are in the left hemiliver and 5 to 8 are in the right hemiliver. So here 1 to 4 and in the right hemiliver 5 to 8. So as per this nomenclature, the segment 1 corresponds to caudate lobe and segment 4 corresponds to quadrate lobe of liver. Segment 1 to 4 of the liver lobe is supplied by left branch of hepatic artery, left branch of portal vein and drained by left hepatic duct. The segments 5 to 8 of right lobe are supplied by right hepatic artery, right branch of portal vein, and drained by right hepatic duct. So this is a little introduction about liver. Now let's move on to location of liver. The liver is almost fully occupies the right hypochondrium, upper part of epigastrium, and part of left hypochondrium. So here we can see, so it is, in the abdomen it is fully occupies the right hypochondrium and upper part of epigastrium, partly the left hypochondrium. It also extends to the left hypochondrium up to the level of mid-clavicular line on the left side. So it extends from fifth intercostal space to the right costal margin in mid-clavicular line. So here is the right costal margin in mid-clavicular line. So that is about the location of liver. Let's talk about the surfaces of liver. The two surfaces of the liver are the diaphragmatic surface, where the diaphragm is related. So the diaphragmatic surface is covered by the peritoneum except in the bare area. So the bare area of liver, it is a triangular area on the posterior aspect of right lobe of liver. So this is the diaphragm. So this upper surface is the diaphragmatic surface and it is covered by the peritoneum except at the bare area of liver. So the next surface is the visceral surface of liver. So here in this image, when you lift the liver, the inferior surface is the visceral surface. And you can see that it is directly related to several anatomical structures. It is related to duodenum. It is related to gallbladder. It's related to hepatic flexure of colon. And it is related to transverse colon. Here in this image, the transverse colon is removed to expose the duodenum. So here is the cut part of transverse colon. It is related to right kidney, right suprarenal gland. So we cannot see the right kidney and right suprarenal gland clearly, but a little part of it is seen. So this is the right kidney along with its suprarenal gland. And so these are the visceral relations of the liver. So that is the relations of liver on the visceral surface. So next we will talk about the ligaments. Ligaments of liver can be classified into true ligaments and false ligaments. False ligaments are formed by the peritoneal folds. So here we can see the falciform ligament. The next ligament is the coronary ligament, right triangular ligament, left triangular ligament, and lesser omentum. So beginning with the falciform ligament connects the liver to the abdominal wall and divides the liver anteriorly into right larger and smaller left lobe, and it contains round ligament of liver on its free edge. The free edge is associated with the round ligament of liver. The next about the coronary ligaments. Coronary ligament is formed by the peritoneal reflection from the diaphragm to the liver, so which has two layers that meet on the right. So here is the coronary ligament. So we can see the coronary ligament is formed due to the reflection of peritoneum over the diaphragm. So the right triangular ligament is a small triangular fold of peritoneum which connects the right surface of liver to the diaphragm. And right triangular ligament, it encloses the apex of the bare area of liver. Next, about the left triangular ligament, it is a mix of falciform ligament and lesser omentum and connects the upper surface of the left lobe to the diaphragm. Next, about the lesser omentum. Lesser omentum, it is the fold of peritoneum connecting the lesser curvature of the stomach and also the proximal 1 inch of the duodenum to the visceral surface of liver. So here the lesser curvature of stomach and the proximal part of the duodenum, which is connected to the visceral surface of liver by means of this lesser omentum. So next we shall talk about the true ligaments. The true ligaments are actually the remnants of fetal structures and includes ligamentum teres hepatis and ligamentum venosum. Ligamentum teres hepatis is also known as round ligament of liver. It is the fibrous remnant of left umbilical vein which still extends from the internal aspect of the umbilicus up to the liver. So here we can see the anterior and the inferior aspect of liver. So this is falciform ligament, and we can see the inferior continuation of it. This is ligamentum teres. So the ligamentum teres hepatis contains obliterated left umbilical vein. So here is the umbilical vein, and this umbilical vein is obliterated in adults completely. So here this is the remnant of umbilical vein within ligamentum teres. Next, about the ligamentum venosum, it is also an embryonic remnant of ductus venosus, and in utero it extends between the umbilical vein and inferior vena cava. So here this venous channel is the ductus venosus, and in adults it forms the ligamentum venosum. So these are the true ligaments associated with the liver. There are other ligaments associated with the liver like hepatoduodenal ligament, and hepatoduodenal ligament connects the liver to duodenum. So here is the hepatoduodenal ligament. And hepatoduodenal ligament contains the portal triad, that is the proper hepatic artery, portal vein and common bile duct. So clinical correlation of this ligament in cases of liver hemorrhage, temporary clamping of hepatoduodenal ligament is done, can help to achieve the hemostasis. So this procedure is called as Pringle maneuver. So this procedure is called as Pringle maneuver, where they clamp the hepatoduodenal ligament. Gastrohepatic ligament connects the liver to the lesser curvature of the stomach. So here is the gastrohepatic ligament, which connects the stomach to the liver, and it contains the gastric arteries. Which contains the gastric arteries, and hepatoduodenal ligament and gastrohepatic ligament together can be called as lesser omentum. So next we shall discuss about the porta hepatis and recesses of liver. The porta hepatis is the central intraperitoneal fissure of liver that separates the caudate and quadrate lobe. So this is caudate and quadrate lobe, and here is the porta hepatis. So here this central portion which separates the caudate and quadrate lobe, and it is the entrance and exit of several important neurovascular structures including portal vein. So this is the portal vein, hepatic artery, this red color structure is the hepatic artery. Then it also contains hepatic nerve plexus, hepatic ducts and lymphatic vessels. So common hepatic duct leaves the porta hepatis, hepatic artery proper and hepatic portal vein enters the porta hepatis. Hepatic nerve plexus and lymphatics are present within the porta hepatis. So next, moving on to recesses, subphrenic recess, which is the split by the falciform ligament of the liver, and it is the division between the liver and the diaphragm. So here below the diaphragm is the subphrenic recess. So this area beneath the diaphragm, it contains. The next is the hepatorenal recess. It is on the inferior right aspect of the liver and it separates from the kidney antero-inferiorly and suprarenal gland posterior-inferiorly. Let us talk about the blood supply of liver. Liver has a dual blood supply. The liver is a special organ in the sense that it receives more venous blood than arterial blood. This is due to the fact that liver helps to clean the blood via detoxification. So as part of liver's dual blood supply, the portal vein allows the tissue to remain oxygenated and preserve the function in the event of obstructed hepatic artery. So the two vessels which supply the liver are hepatic artery proper, which supplies around 20 to 40% of the blood. So hepatic artery proper, it is a branch of common hepatic artery which branches off the celiac trunk of the abdominal aorta. So this common hepatic artery is in turn a branch of celiac trunk. Celiac trunk is the branch of abdominal aorta. So most of the blood supply to the liver is by portal vein. Portal vein supplies 60 to 80% of the blood. So portal vein carries the blood filled with the nutrients, means filled with the metabolites absorbed in the intestine. So here is the portal vein. And we can see that portal vein forms from superior mesenteric vein and splenic vein. Superior mesenteric vein and splenic vein both joins to form portal veins and which collects the blood from the gastrointestinal tract, spleen and pancreas. Despite being deoxygenated, it still supplies the liver with about half of its oxygen demands. So delivers nutrients and other metabolites via this portal vein. Next we shall talk about the venous drainage of liver. Hepatic veins drain the liver. So the hepatic veins are formed by the union of central veins drain into the inferior vena cava. So these faint colored veins are the hepatic veins. And we can see they are draining into inferior vena cava. So they drains into the inferior vena cava just before it passes through the diaphragm. And finally inferior vena cava opens into the right atrium of the heart. Moving on to lymphatics, the lymphatic drainage is mediated chiefly by hepatic nodes which can be found around the porta hepatis, and from there they continue to form celiac nodes or celiac lymph node clusters and eventually drain into cisterna chyli. So that is the lymphatic drainage of liver. And let's see the innervation. 𝐒𝐮𝐻 capsule and serosa is innervated by lower intercostal nerves, whereas the parenchyma, that is innervated by the hepatic plexus. Hepatic plexus contains both sympathetic and parasympathetic component. Sympathetic formed from celiac plexus and parasympathetic are derived from vagus nerves. These two nerves, that is sympathetic and parasympathetic components, which regulate the metabolism, blood flow and bile secretion. So distension of the 𝐒𝐮𝐻 capsule results in well localized sharp pain as in ascites or inflammation or hepatic cancer, because this capsule contains the pain receptors and it is supplied by somatic nerves, so that's why it is pain sensitive. Let us talk about the functions of liver. Liver is classed as a gland and associated with many functions. It's difficult to give a precise number as the organ is still being explored, but it is thought that the liver carries about 500 distinct roles. The major functions of the liver include bile production. So the bile helps the liver where the intestine break down and absorb fat, cholesterol and some vitamins. So bile consists of bile salts, cholesterol, bilirubin, electrolytes and water, and absorbing and metabolism of bilirubin. So bilirubin is formed by the breakdown of hemoglobin. So the iron released from the hemoglobin is stored in the liver or bone marrow and used to make the next generation of blood cells. So supporting blood clots. So vitamin K is the necessary for creation of certain coagulants that help to clot the blood. So bile is the essential for vitamin K absorption and is created in the liver. So if the liver does not produce enough bile, the clotting factors cannot be produced. And liver is very important in fat metabolization. So it is very important lipid metabolism. So bile breaks down the fats, which helps in saponification and emulsification of fats and makes them easier to digest. Liver is also very important in metabolizing carbohydrates. So the carbohydrates are stored in the liver, and where they are broken down into glucose and siphoned into the bloodstream to maintain normal glucose levels. So they are stored as glycogen and released whenever a quick burst of energy is released. Liver plays a very significant role in vitamin and mineral storage. The liver stores vitamin A, D, E, K and B12. So it keeps a significant amount of these vitamins stored in the liver. So vitamin D. Conservation of vitamin D3 and D2 to 25 dihydroxycholecalciferol, which is subsequently transformed to 125 dihydroxycholecalciferol, which is the active form of vitamin D in the kidney. And liver also helps to metabolize proteins. So bile helps to break down the proteins for digestion. And liver is the main filter. So it filters the blood and removes the compounds from the body, including hormones and such as estrogen and aldosterone, and compounds from the outside the body, including alcohol and other drugs. Liver plays a vital role in immunological function. So the liver is a part of mononuclear phagocyte system. So it contains high number of Kupffer cells, which are the macrophages that are involved in immune activity. So these cells destroy any disease causing agents that might enter the liver through the gut. Liver helps in the production of albumin. Albumin is a protein and is most common protein in the bloodstream, and it transports fatty acids and steroid hormones to help maintain the correct pressure and prevent the leaking of blood vessels. Liver is the house for the synthesis of angiotensin. This angiotensin hormone raises blood pressure by narrowing the blood vessels when alerted by the production of an enzyme called as renin in the kidneys. Liver is very important in energy metabolism, glycolysis. So glycolysis takes place in the cytosol of every cell, not just in the liver. And beta oxidation. Beta oxidation also takes place in the muscle cells apart from the liver. Then amino acid degradation, lipid metabolism. So lipid metabolism, expression of low density lipids and lipid remnant receptors are associated with the liver, and production of nascent high density lipids which transports cholesterol from periphery to the liver. High density lipids and chylomicrons transport cholesterol from the periphery to liver, and liver delivers triglycerides to peripheral tissue via the very low density lipids. So that is how the liver is important in lipid metabolism, and liver also breaks down the fructose, and it also helps in the breakdown of serotonin hormone. Liver plays a vital role in the synthesis of glucose, which is called as gluconeogenesis. So most of the gluconeogenesis takes place in the liver and to a far lesser extent in the kidney. So the liver expresses glucose 6-phosphatase, a central enzymatic step in this pathway. Production of ketone bodies, so that provide energy to the muscles and brain. So fatty acids and amino acids are turned in the liver as acetoacetate plus beta hydroxybutyrate. Synthesis of plasma proteins. Acute phase of reactants such as ferritin, CRP and hepcidin occurs in the liver. And liver also is important in cholesterol biosynthesis. Fatty acid synthesis also. So in fatty acid synthesis, one of the few tissues along the side of lactating mammary glands and adipose tissue, liver performs fatty acid synthesis during fasting. For example, during day 1 fasting, the glycogen reserves used for gluconeogenesis. During days 1 to 3 of fasting, up to 3 days of fasting, the glycogen is depleted, so leading to the production of free fatty acids for energy. In fetus, the liver plays a very important role in erythropoiesis. Liver is the site of erythropoiesis from 6 weeks of gestation until birth. Let's talk about the histology of liver. Liver, we know it is peripherally covered by the visceral peritoneum, serosa that covers the liver. And looking at its lobules of liver, there are sheets of connective tissue that divides the liver into small hexagonal units called as lobules. So lobules of the liver, there are you can see the connective tissue sheets. Which divides the liver into hexagonal lobules, and each lobule consists of central vein in the middle. So here is the schematic image where it is more magnified to show the components of lobule of liver. So each lobule of liver consists of central vein in the middle, and it contains portal triads at the vertices. So every corner we can see the portal triad. So portal triad consists of a branch of hepatic artery proper. So the red one is the hepatic artery proper. And it contains a branch of portal vein. And it also contains bile ductule. So all these three components together called as portal triad. So apart from portal vein and hepatic artery and bile ductule, portal triad, near the portal triad, the connective tissue also contains lymphatic vessels and branches of vagus nerve. So the liver consists of major histological components like parenchyma, stroma and sinusoids, spaces of Dicey. So let's begin with the parenchyma. Parenchyma mostly consists of hepatocytes. The hepatocytes may have 2 or 4 nuclei, and if we see each nuclei, they are quite large and spherical and occupying the central portion of the cells. So each nucleus has a minimum of 2 nucleoli. They contain large amount of smooth endoplasmic reticulum which is involved in detoxification. Lifespan of a hepatocyte is around 5 months. The adjacent hepatocyte leave a very small space between them known as bile canaliculi. So the adjacent hepatocytes, we can see the spaces bile canaliculi which are almost 1 to 2 micrometers in diameter. The cell membranes near these canaliculi are joined by tight junctions. Basolateral surface of hepatocytes faces the sinusoid. The apical surface of the hepatocytes faces the bile canaliculi. Next, regarding the connective tissue or the stroma of the liver, stroma, which is the continuation of surrounding capsule of the liver called as 𝐒𝐮𝐻 capsule. It consists of mainly the connective tissue and contains the vessels. The capsule is also covered by a layer of mesothelium arising from the peritoneum covering the liver. The connective tissue of the stroma is made of type 3 reticulum or type 3 collagen fibers which forms the meshwork that provides integrity for hepatocytes and sinusoids. So surrounding each lobule is the connective tissue which contains several blood vessels in it. Sinusoids. Sinusoids, which are the capillaries traveling between the hepatocytes. Sinusoids are large capillaries lined with highly fenestrated endothelial cells, and blood flows through the sinusoids and empties into the central vein of each lobule. So let's talk about the functions of sinusoids. Sinusoids are meant for the absorption of nutrients from the blood and secretion of the products synthesized by the special carriers into the blood, and also contains Kupffer cells. Kupffer cells are the macrophages which phagocytize foreign particles, bacteria, and damage old blood cells. The space around the sinusoid is called as perisinusoidal space, which is filled with the plasma fluid, and it contains hepatic stellate cells, which are otherwise called as ito cells. And hepatic stellate cells store vitamin A and are main source of extracellular matrix, which is helpful in the production during liver injury. So extracellular matrix is produced in liver injury. So that is the formation of scar tissue due to fibrosis. Apical surface of hepatocytes faces bile canaliculi. So hepatocytes secrete bile into the canaliculi, and these secretions flow parallel to the sinusoids but in opposite direction of blood. So bile canaliculi from the intrahepatic bile ducts flow the bile into the common bile duct. So from there the bile is delivered into the second part of duodenum. Next, regarding the spaces of 𝐷𝐶, which is otherwise called perisinusoidal spaces, which are located between the hepatocytes and sinusoids. So you can appreciate this space is situated between the layers of hepatocytes and sinusoidal endothelial cells. The hepatocytes extend villi into perisinusoidal space, increasing the extent and the rate of material exchange together with microvilli. Perisinusoidal space contains a space type of cell called as hepatic stellate cell or ito cells, and they are, as discussed earlier, it is responsible for the storage of vitamin A inside the lipid droplets, which is subsequently released as retinol. However, these hepatic stellate cells are also responsible for the hepatic fibrosis, that is the formation of scar tissue, since they are once secreting large amount of collagen during liver injury. Structure of the liver. In histological terms, liver consists of large number of microscopic functional units that work together to maintain uniform activity of the gland. There are three possible ways describing one such unit. So the hepatic lobules, you can describe different units: classic lobule, portal lobule, and liver acinus. The classic lobule. So the classic lobule, here in this image you can appreciate the classic lobule. It consists of hexagonal plates of hepatocytes and stacked in arranged in the top with each other. So within each plate, the hepatocytes radiate outward from the central vein. So as they extend towards the periphery, the hepatocytes are arranged into strips similar to like a spokes of a cart wheel. Hepatic sinusoids travel between the strips of hepatocytes draining into the central vein. So you can see here the central vein where the hepatic sinusoids drain into the central vein. Then one portal canal is located to each corner of the classic lobule and making a total of 6 of each lobule, and these portal canals are composed of portal triads surrounded by loose connective tissue. Periportal space, which is called space of Moll. Space of Moll where the lymph is produced and is sandwiched between the connective tissue and portal canals and hepatocytes. So this space is called as periportal space, which is otherwise known as space of Moll. Next, about the portal lobule. So as we discussed in the classic lobule, which focuses on the blood supply and hepatic mass arrangement, the portal lobule explains about the exocrine function of the liver. That is, it explains bile secretion. So in this scenario, each functional unit is like a triangle having a central axis through a portal canal and imaginary vertices through which the three different but closest portal canals surround it. So the area covered by the triangle represents the hepatic regions that secrete the bile into the same bile duct. Next, we shall discuss about the liver acinus. This liver acinus focuses on the perfusion metabolism and pathology of hepatocytes and also provides more accurate explanation regarding physiology of the liver. So liver acinus is the functional unit and it is in the shape of an oval. So the short axis is represented by the shaded border between the two adjacent lobules together with the portal canals. The long axis is an imaginary line between two adjacent central veins. So this is the liver acinus. So each liver acinus can be divided into three histologic zones. That is zone 1, which is called as periportal zone. Periportal zone is affected first in viral hepatitis and toxic substance ingestion. So the hepatocytes in zone 1 receive the highest amount of oxygen and it is the one closest to the short axis, hence the portal canals and supply of the arterial blood. Then zone 2, which is an intermediate zone and affected in yellow fever, and it is the one located between zone 1 and zone 3. Zone 3 is the pericentral zone, which is otherwise called as centrilobular zone, which is affected first in ischemia and alcoholic hepatitis, and it is the most sensitive to metabolic toxins like halothane, and it has the highest amount of cytochrome P450, and it is one furthest from the short axis but closest to the central vein. Hence the hepatocytes receive the least amount of oxygen. So let's talk about the embryology or development of liver. Liver is an endodermal in origin, derived from the junction of foregut and midgut. So ligamentum teres formed from the obliterated umbilical vein. So the size, the liver initially occupies the entire anterior body area and it contains hepatoblast. Hepatoblast cells are derived from the endoderm and they are bipotential progenitor for both hepatocytes and cholangiocytes. And vasculature which is derived from the mesoderm. So mesoderm, blood vessels enter the liver, and there are three systems: systemic circulation, placental and vitelline circulation. Sinusoids. First, blood vessels from the vessels of septum transversum mesenchyme and initially contain endothelium and become fenestrated in the fetal period and reticular development ongoing. Liver buds. So liver buds differentiates to form liver diverticulum and hepatic primordium and generates the gallbladder and then divides into right and left liver buds or hepatic buds, and three connecting stalks, that is the cystic duct, hepatic duct, which fuse to form bile duct. Then left hepatic duct or quadrate or caudate lobe, both quadrate and caudate, anatomically from the left hepatic bud, and caudate lobe of the human liver consists of three anatomical structures, which are the caudate process, paracaval portion, and Spiegel's lobe. Right hepatic bud derives to form right lobe of liver. Let's see the structural origins of liver. Hepatic buds form the hepatocytes and produce bile from week 13, that is 13th week of gestation, forming meconium and of the newborn. And vitelline veins form the sinusoids, and mesenchyme from the connective tissue and Kupffer cells. During intrauterine life, the liver acts as a hemopoietic organ where the hemopoiesis occur. So embryonic liver is also involved in blood formation. So after the yolk sac, the blood islands acting as the primary site. Hepatoblast. So hepatoblast are derived from the endoderm. So they are endoderm derived cells which can differentiate into either hepatocytes, populate the bulk of the liver parenchyma, or they differentiate into cholangiocytes which line the intrahepatic bile ducts. So moving on to the surgical anatomy after embryology. So access to the liver for hepatic resection is achieved by mobilizing the liver from its various ligamentous attachments, including the coronary ligament, the right and left triangular ligaments. The porta hepatis contains the structures that enter the liver and leave the liver. So gastrohepatic ligament may contain the accessory vessels that needs to be controlled. Segmental anatomy of liver. Liver is divided into two lobar segments, right and left, and it is further subdivided into 8 segments, which are called as conoid segments. Conoid segments based upon its vascular supply and bile duct distribution. So numerous anatomical classifications are available for liver resection. The 8 main segments are based upon the portal vein anatomy, including caudate lobe, which is considered as segment 1. The 9th segment is sometimes described as the portion of segment 1, but to the right of inferior vena cava. Although interesting proximity to the inferior vena cava and anatomical variability make formal recognition of the 9th segment of little consequence to hepatic resection. 4 sectors are based upon hepatic vein anatomy. Caudate lobe is not included here. These sectors are the right posterior segment, segment 6 to 7, right anterior segment, segments 5 to 8, left medial segment, segment 4, and left lateral segments, segment 2 and 3. The 2 sectors describe each hemiliver, the right and left. So left hemiliver, that is the left medial and left lateral segments, which include segment 2, 3 and 4. Right hemiliver, that is the right posterior and right anterior segments, which include segment 5, 6, 7 and 8. Excepting the caudate lobe, the right and the hemilivers describe the liver into the entirety. So that is about the normal anatomy, clinical anatomy as well as functional anatomy of liver. Thank you.